Well, hello again, everybody. Today is Wednesday, February 17th. Welcome back to the Keep Boone Healthy Information Channel. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce, with our good friends in the vaccine deployment industry here in Watauga County. Of course, we have Jennifer Greene, Director of Public Health for AppHealthCare. We have Sean Burroughs, Director of Pharmacy for Appalachian Regional Healthcare System. And we have a new guest with us now. Alice Salthouse is the CEO of High Country Community Health. These three agencies are deploying vaccine in our community, and they've got some other partners that are helping them as well, like Boone Drug, Samaritan's Purse. We'll get into that in a little bit. But as we've said throughout the course of these last several weeks, we'd like to come to you weekly and just kind of give you an update on where things are in the deployment strategy, where numbers of vaccines are, and where things are moving as we progress through these groups in North Carolina's vaccine deployment strategy. Keeping that local context, very important for us to understand. While some decisions may be made at the state level, it sometimes takes a little while for those things to actually trickle into our own backyard. So that's where this has hopefully been helpful to you, and we'll continue this conduit of information as long as it's necessary as we work through this strategy together. So Jen, if you want to give us kind of the ballpark update here. I know that there's been a lot going on still in discussion about last week's announcement as it revolves around the group 3 timing. And that was educators, childcare workers, pre-K through 12th grade, starting on the 24th. That's 1 week from today as we record. What more dialogue has there been about exactly how that process will be administered, not only here in Watauga County, but throughout the state?
I think the biggest thing to know, David, is we had that big announcement, and as vaccine providers, really what we're trying to do in our community is have a conversation about how we look at the people who have been waiting and the public health risks that certainly are important to consider with people who are older adults that we know are at higher risk for severe illness and death. But also recognize the value that we have with childcare workers and school staff, and the importance of making sure we are moving forward in this vaccination effort. So I think we've been gathering a lot of data. We have not completed that process yet, but we are in a lot of conversations about how we can work together to make sure that we're continuing to prioritize the older adults, but also make sure that we're working through school and childcare staff.
So with that, we've talked a lot about the fact that this is a community-wide effort, and it's tough when you get into subcategories. While we want to pay attention to the subcategory of the moment, if you will, because everybody's had their time in the sun thus far, you have to think about the grander strategy within that. And that, of course, leads to more providers helping with this process. And Alice, that's where we can kind of bring you into this conversation. We have mentioned High Country Community Health over the last couple of weeks as a relatively new provider in this relatively new process. But what can you tell us about what you and your staff are adding in terms of yet another location, another voice at the table as we continue to see this strategy evolve?
Thank you, David. It has been an adventure, that's for sure. We have much smaller allocation of vaccine than the hospital and the health department. And so we've been working with our patients primarily, but we also have been taking people from the community to make sure when they call that if we have an appointment, vaccine available, we give those vaccine to those folks. In the coming weeks, there has been on the national level word that community health centers across the nation may be receiving some vaccine through the federal government. And so that would be adding to what we get from the state. We have not gotten word on what that allocation would be. I think there are like 1,400 community health centers across the nation. And I think this week they have allotted some to 25. So it's starting off small. They're going to make it bigger. And as we know more about those allocations, we'll let you know if and when those happen for us here in Boone.
Well, certainly then you kind of get a sense of just how many partners do come together, where those sources may come in a little bit different places than what we saw at the very early onset of all of this. I think also important to note how things are going on the ground here. And Sean, you have been very involved in a clinic transition over into the rec center space, both the hospital system and the health department utilizing that facility now. What can you tell us about that process as people start to see that more as the destination to go to get vaccinated when their name is called?
Yeah, first, I'd like to again thank the county for offering up the rec center for vaccinations. Logistically, it's the best place that we've been able to give vaccine so far. It's a beautiful space, and truly, I can't wait selfishly for it to open up to the public to be able to see that. But we are really appreciative to be able to use it now and for the near future, as well as hopefully we get more vaccine and the phases continue to open up. This is an ideal location to be able to have a vaccine clinic. So thank you to the county for that. And then, yeah, as you mentioned, both AppHealth and ARHS right now are utilizing the gymnasium, one of the gymnasiums for the clinics. And we're working through all the vaccine that we have. As you have mentioned previously, this week has been a bit of a struggle. I'll lead into probably your next question about the weather, but it's been a bit of a struggle. We haven't received this week's allocation, neither has AppHealth. So we're dealing with a lot of variables and an ever-changing vaccine rollout. But the one constant for the past few weeks has been this rec center, and it's been very helpful for us.
Well, and I think before we get into the new challenges, we'll save the new stuff for just a moment. But I think sometimes when we get involved, especially here in COVID, we have been dealing with so many new processes, new procedures. It is easy sometimes to forget about what the end user experience is like. And I know that you have been there in the trenches for so many of these vaccination efforts. Can you give folks a sense that maybe haven't been through the line just yet of what the emotional release is like for someone that gets that second shot or even gets the first one and is at least a step closer to a significant benchmark in what has been a year-long emotional roller coaster?
It's absolutely amazing. And it's usually the first one. It's just kind of it's a release, as you said, it's a relief. But it's been amazing to me to not only see the patients coming through and the energy and the excitement that they have and the relief for finally getting the first dose, but the hundreds and hundreds of volunteers that continue to pour out and offer up their services. We continue to have more volunteers than we have positions for, and the energy level for everybody in the community to be able to see. I've heard a couple of people this week say it fills their cup. So the volunteers come and it fills their cup just to see everything, all the work that's been done to get to the point of actually putting a shot in the arm. There's a lot of work behind the scenes that has to happen. When you actually get to see someone put a shot in the arm, you get to see the relief of the patient, you get to see the excitement of the volunteers. And deep down, you know that, for every few shots that you give, it's a hospitalization that's not going to happen. And as you go further, it's a life saved. So they're long days, they're long hours, but man, it's fantastic when it finally does end up getting in the patient's arm.
Well, and as we see those satisfied folks leave those facilities, it does cause some of us that have those logistical minds to back up and think about all that went into that process, even being able to occur. So to all of your staffs, those that are using both paid positions and volunteer positions to make these things work, we certainly tip our cap to you. I know that you want to do more. It becomes a resource issue. And so now, Sean, we'll get into that next question and we'll throw this one to Jen. This has been an evolving challenge, and now you've got a new hurdle, and that being ice and snow and winter weather fun that we are used to here in the high country, but have not had to balance around vaccine deployment in a while. So tell us a little bit about, I know that you stated in the county commissioners meeting, it was reported earlier this week that there is an allocation of vaccine that is coming to the county. I know you had some intentions on how you wanted to roll that out this weekend, but what has the weather done to those plans and how do you plan to adjust based on that?
Yeah, we had about 3,000 vaccines coming due to a request that we put into DHHS a while back together. And we were very excited to get those vaccines. And then we learned that because of the weather system across the country, they haven't been shipped to us. And so we're just going to back up and we're going to ask for people's patience, reschedule things, and just bump to next week and try to move forward. That's our plan right now. And I know that it's incredibly challenging to think about being excited about that first dose and then being asked to move to the next area. But we're really grateful to the volunteers and all the providers who are helping plan these mass clinics, because it truly is taking all of us to put our staff and our teams in place to schedule and reschedule. And certainly not what we want to have happen for the end for the patient, but it's what we have right now, and we're going to work through it the best we can. And know that, when it is time, and hopefully that's next week, we're going to have more people vaccinated, more people protected in our community.
Well, and I think that people begin to understand a little bit of the math equation here that works out, and that we've heard from the state that there is a priority to move to that group 3, and that occurs at some point in time next week. At least allowing to move doesn't necessarily mean that a move will physically occur. But then you've also got a list that hopefully is dwindling by the day of 65 plus, and the group 1 folks that are still eligible for the vaccine. So how are you 3 working together to make sure that while you've got this, and I hesitate to call it downtime because that's not what it is, but while you're waiting for old man Winter to loosen his grip, what are you doing administratively to make sure that you have a better awareness and understanding accurately of how many people remain in that second group, and how quickly you might be able to kind of polish that group off, if you will?
Well, I can start and just say what we've decided to do is compare notes a little bit, look to see if we have duplicates. We know that there's so much emotion in this whole movement to try to be vaccinated. People are putting their names in lots of places. And so we're going to start there. And we're also gathering a lot of information from childcare and school providers to try to have a better understanding of exactly how many people we will have to vaccinate in those groups, so that if we have to break it up over a period of time, or if we're able to do more, depending on what kind of vaccine we have next week. I mean, I think that's really what we're trying to do is compare our lists and sort of scrub them a little bit, see how far we are. I will say I'm really proud of how far the progress we've made to date in getting the older adults and healthcare workers vaccinated. So that's what we're going to do, is just try to take another look in detail.
Alice, you're seeing people from a variety of walks throughout the community come through here as well, and try to get themselves either on the right list or on a list. Can you give us an understanding of kind of what that demographic looks like? We've heard tale of folks from other states, neighboring states, trying to get involved. Have you seen any of that through your more community group versus one that is tied to a specific provider?
Oh, yes, we have. We're in 4 different counties, High Country Community Health. And this Saturday, we had an event in Surrey, in Elkin, North Carolina. And we had folks that were there from Watauga County coming to Surrey to get their vaccinations. And you feel bad because you might have one individual that's 65 and over, and they've called and they're on 2 or 3 different lists in different places. So for us to understand where we stand, and then we're moving into a new category, trying to, we have so much to be thankful for the leadership of Jennifer Greene and Sean Burroughs, the folks that are working, striving to make it be equitable, striving to go by what the rules are. But I will tell you a quick funny story. In Surrey County this weekend, I had a retired school principal who's now a professor at ASU, who was talking about how the vaccine hesitancy that people have, that some people are so afraid to get the vaccine, and how there are those other people who really, really, really want it because they want to go out, be in public, see their grandchildren. And he said, a very educated, smart professor he said, I don't care if I grow 3 horns and an extra ear from this vaccine. I'm getting it because it's a whole lot better than dying. But anyway, we do see a wide variety of opinions and of folks that need to get in, even in the age group, lower age group that have so many health issues. And it is a struggle. And we're in public health. We're trying to do the best job possible. And honestly, David, when I look at the different counties in which we work, high country, and I look at the leadership that you have here in Watauga County, you're ahead of the game. You've got really good people with passion and good sense doing this. So anyway, we'll get through it, but it's going to take a little while.
Well, Alice, you and I could keep talking about them. I agree with you. I think they're doing a great job. So I know they probably won't comment, but I appreciate you saying that. Two final questions to kind of close down this session. And Sean, I'll throw this one at you. And Alice brings up a great point in people and their awareness about the vaccine process. Maybe it's they talk to the trusted relative who's in the healthcare profession, or the neighbor down the street that got it and everything was okay. Because you work with the finite group that is ARHS patients, have you seen many people that are coming to the party now, so to speak, and saying, you know, I've been eligible for a while, but I've hesitated to put my name on the list because I just wasn't sure? Is that doing anything to kind of change the moving target that is the number of folks that may be left in a particular group at this point in time?
Yeah, definitely. That's a great point. We vaccinated obviously a percentage of our staff initially that were eligible to be vaccinated. And over the past, I would say over the past month, there's been a lot more interest for those that chose initially not to, just because of questions like everybody else had. But I think community-wide, certainly in the hospital, and I would say community-wide, people are seeing that people are getting vaccinated and they're doing okay. You might have to deal with a day or two of, cold, flu-like illnesses or something like that, but it's not as bad as a lot of people were concerned about. So yes, absolutely. We in ARHS, we're seeing more people come to the table. And I think the community is.
Sean disappeared on us. Cell phone battery died. All right. So then that leads into the last question for you, Jen. I know that we have talked a lot about, this new move into group 3. There was a subcategory that was made within that, or a sub prioritization. Not necessarily sure, but I think it's probably likely that we'll see some further sub prioritizations occur as we move through not only group 3, but other groups down the road. At this stage in the game, do you see any other major changes at this point in time that could continue to no other way to say it than complicate this process a little bit? How are you and your staff trying to work within the rules that are there now, but also trying to guess a little bit down the road and anticipate what may be to come?
I think the biggest thing we're trying to do is think about our capacity, and if we have a bigger population group to vaccinate, together with other vaccinating providers, how do we make sure that those places really have the information they need to connect their employees to us? And I think, we want it to be a simple process. We've got our vaccine interest form, but we're probably going to be doing some additional outreach with employers specifically to try to help them navigate some common questions. Just simply things like, should I stagger how I do my staff? If everyone wants a vaccine, which is what we hope, how do we make sure everyone gets a vaccine and it doesn't, negatively impact your ability to do your operations and things like that? I think that, and then just holding our breath for any other additional updates that we might get from the state. I think we are trying to be resilient and adapt as the changes continue to roll, and be able to continue to grow in our capacity to roll out more vaccine together along with our other partners. And volunteers are a big part of that. I just want to say we so appreciate volunteers. They've been such an important effort supporter and have really helped make all the difference.
Sean, we're going to go ahead and let you finish your thought, because there is nobody that's watching this video that hasn't been on a Zoom call where somebody's dropped out before. So we can all understand that technology is what it is. You guys are moving around in the squares a little bit here. But I know we were talking with you about folks' willingness to put their names on the list and how that continues to evolve. Any final thoughts you have on that?
Yeah, I'll try to be quicker. My phone overheated somehow. I don't know what's going on. It's been a day, David, but yeah. So to summarize, yeah, we've seen more and more people that have seen the vaccine being given and realize that there, at least short term, there aren't, as many issues as many people were concerned about. So we've seen the uptick in ARHS increase over the past few weeks. And I imagine community-wide, we're going to see that as well, that the more and more vaccines rolled out, the more and more people that are tolerating it well, and obviously saving lives with the vaccine, I have a good feeling about the percentage of folks that eventually are going to end up getting vaccinated.
And a real quick follow up to that, and maybe you all three need to answer this individually, for those folks that may have thought that their time had passed because they didn't get in on it initially. What are the steps that somebody that's in an eligible group can go through now to make sure that they get their name on a list?
I think don't wait.
Go ahead, Jen.
Yeah, go to one of our websites and sign up now. It's not too late, or call us. We are happy to take you. If you've been on the fence, you've been thinking about it, we want you to get a vaccine. There is a vaccine for you. Don't wait.
I know that we've talked in detail on this channel about how to do that with AppHealthCare and with the Appalachian Regional Healthcare System. Both have very detailed COVID-19 vaccine information available right on the top of their websites. Alice, can you give us a rundown real quick, just because we haven't had a chance to ask you the question yet? If anybody's interested in interfacing with High Country Community Health for this, how can they get their name to your staff?
So I have a phone number, and that is 828-262-3886. And you just call there. And like I said before, our number of vaccines is far fewer than the others, but we're here and we're taking community members. And David, I really want to thank you for putting this out there to educate the community and let them see a little bit about what's going on. Thank you for what you're doing as well. We all work together to make this happen.
Well, I continue to appreciate y'all's willingness to take time and explain this. I think context is a wonderful thing. We can see things, hear things, think that we see things, but when you hear from the people that are involved in the day-to-day operation of how something like this, that's never been done before at this scale, or at least in quite some time, is actually being, put through the process, it helps you anticipate a little bit more and understand truly how some of these things work. I do want to make sure, I'm going to assume this again, but I don't want to assume. I want to see the head nods. If you haven't put your name on a list yet, we're asking you not to put your name on all three, correct?
That's what we would prefer. You pick one.
Okay. All right. I think we can, in this space, we can safely say yes. Pick one and stick with that one. But I hope that this helps kind of let you know what that process is like too. You don't need to spread all over. You've got three providers here that are working with each other as best they can, as rules allow, to be able to share those lists and make sure that they're working off one, kind of collective community list, rather than having to waste staff time calling through all of you, or all of them calling you, trying to get you scheduled. So know that from an operational standpoint. I know it feels like it's best to hedge your bets, but pick one, call them, trust the process, and hopefully we'll all get these shots deployed throughout our community, and we'll continue to keep Boone healthy in the process. So thanks again for all of your insight. I know we'll have more details to share next week, and we'll look forward to that opportunity, and we will wish you all a good and safe and hopefully not so icy weekend.
Thank you, David.
Thanks, David.
Thanks, everybody.